Welcome back. Thanks for staying with us. The Department of Health urges people to take precautionary measures and maintain proper hand hygiene as there's an outbreak of a diarrheal disease as well as a spike in cholera cases. In Gauteng, at least 6 people have died at Jubilee Hospital and more than 50 others are receiving medical care following an outbreak in Hammanskraal. For more on this, we are joined now by Mondli Mvambi from the Free State Health Department, the spokesperson there. Very good evening to you, Mr. Mvambi. Thank you so much for your time. The department has sent out a warning urging people to take extra precautionary measures when it comes to hand hygiene. Talk to us about some of the developments and experiences in the Free State.
Well, we have seen, good evening to your viewers all over the world. We, in the Free State, in the area called Vredefort Mokwallo, in Fezile Dabi district, is northern part of the Free State. We have seen about 76 cases. Seen there is confirmed, in fact, as people that were sick from apparently contaminated water. But 6 of them were then confirmed as cases of cholera, which underwent treatment in the Paris hospital, and some were told that they were seen in Buitumelo Hospital, which is in Kroonstad. And these cases then have since been discharged, and their contacts are under surveillance as well, so that it is guaranteed that nothing happens from them. What we can confirm from the Free State again is that these 6 people that have now been discharged have underwent treatment. They are okay. They are not a danger to anybody. But the outbreak response teams and our surveillance teams are keeping a careful watch on them to make sure that they are fine over time, including their contact cases.
I understand that response teams have been sent out to try and get to the bottom of the source of the outbreaks. What's that looking like? What has been established?
Well, nothing has been established so far, except that we are making sure that the hygiene education is going extensively in that area to make sure that people continue to wash their hands with water and soap. And they also boil any water that they are drinking, but they are also careful of any source of contamination that they might be coming into contact with. Water samples have been taken from that area. They've been sent to different labs just to make sure that we get the results that will confirm the source of the infection of that has been happening in that area, including cholera itself.
The diarrheal disease is set to be a common one and highly infectious, which that affects the stomach and the intestines. When it comes to looking at children and other members of the public who may experience symptoms, what is it that you'll be looking out for as you try and get to the bottom of the source of this outbreak?
Well, the people that have been seen with diarrhea, we make sure that we treat that diarrhea, but we are focusing on community education, just to make sure that the sources of water are not contaminated. For instance, just to make sure that people drink safe water. Wherever the source may be, we are asking them to please boil the water. Whether it's from the boreholes or the taps in that entire vicinity, make sure that you boil the water before you drink it. Make sure that you wash your hands regularly. From school children, from little children to adults, everyone must just make sure that they adhere to the hygiene measures, because they are the best weapon right now that we have that can help us to curb the spread of any infections, be it the diarrheal infections or even the cholera, potential cholera infections themselves.
What are your leads as you try and get to the bottom of this? I mean, what is commonly known when it comes to accessing water in the parts of the area that you've mentioned? You've mentioned the area of Vredefort and Parys under the Free State province. Talk to us, perhaps just paint a picture of what are the likelihoods when it comes to possible contamination.
No, we can't cast any aspersion at this point in time in terms of the sources, but we know that the people in that area drink water from the taps. They've been drinking water from the JoJo tanks. They've been drinking water from boreholes. So all those sources are being looked into just to make sure that any source there may be, it is tested and confirmation is factually made at the end of the day as to what could have been the source of the infections. That is why we're insisting that to curb any potential spread, let water be boiled, let people adhere to highest levels of hygiene, alertness, and make sure that everybody is safe in that area. Up until we have found the lab results, confirmed sources that may lead us to what the potential reason is for the infections in that area.
As you try and get to the bottom of everything, what are some of the biggest concerns that you have as a department?
Well, the concern that we've always had as a department is that generally people don't adhere to highest hygiene measures. People take it for granted that washing hands is something that they can do whenever they can. Some people do not wash hands accordingly in terms of the approved infection prevention control measures of hand wash, and some of them they wash hands without soap. Some of them wash hands from the same contaminated sources and they touch food afterwards. So we always say from the time of COVID, we have learned that hand wash is the biggest source of curbing any infectious diseases, and if you adhere, the potential infections they tend to go lower. So we would encourage people right now to take this opportunity to learn more about better ways of adherence to make sure that their lives are safe. So wash your hands regularly. Wash as regularly as you can, irrespective of what you've been doing. Don't wash your hands in the morning and say, no, I've washed your hands. Wash them every time, every opportunity you have, including more especially when you're about to touch food. It is even more imperative.
You speak about COVID-19, and there were some really important lessons learned throughout the world and the provinces, of course, when it comes to how COVID-19 was managed and contained. What lessons do you think you can draw from the strategy around COVID-19 in terms of containing and curbing the numbers as the likelihood of the spreading happens?
Well, firstly, the organizational arrangements that we learned from COVID-19, they have taught us well that, the strengthening of the outbreak response teams working together, you are able to eliminate any potential speculations and missing of the sources of the infections. So the teams there are working together. You've got the local municipality, Mwati municipality, Fezile Dabi, district municipality, WHO, NICD, working with the department and the community. So we're able to do risk communication and community engagement so that people know right on time about what could be the problem in their own area, and they know what behavior change they need to adapt to make sure that the source of infections are kept right at the source. So that is why we've been able to get into that community, to teach them, educate and raise awareness about infection prevention control measures, but also for them to lead us to the sources of water that they are using in that area, so that we can be able to eliminate any kind of speculations. So good lessons we have learned, and the best weapon that we have right now is that one of hand hygiene, and we encourage people to adhere to it and make sure that whenever they feel anything that is unusual in their way of life or their bodies, they are able to report it, and their clinics are able to assist them to higher levels of care in cases people get seriously sick, and the hospitals, they are able to treat people accordingly.
Very well. Thank you so much for your time. Let's perhaps leave it there for now.